Hi, this is Aaron Patzer, the CEO and co-founder of Vital. Today, I wanted to walk through our UrgentCare product. UrgentCare works in much the same way that emergency does. So when somebody walks in and registers, we scan for a phone number in the EHR record, send them a text message invite. They just click a link that says, do you want to know what your lab results and your wait times are? Click here. We can also trigger that invite prior to their arrival on a pre-scheduled visit. And a future version will actually handle the pre-registration and scheduling itself. We don't do that today. So you click on that link, and this is a progressive web app, so there's no download, no username and password. It's like a one-time use link. Last name, date of birth, multilingual, English, Spanish, Vietnamese, everything that Vital supports in its other products. And this is, of course, customized to your facility. It looks a little bit like an abbreviated emergency room visit. You'll be seen by a nurse in 10 minutes, 15 minutes, 5 minutes. But there's only a few steps: registration, treatment, discharge, because it's going to be shorter than emergency. There'll be little cards like, did you know you can schedule a visit, so that people who come in can pre-schedule and you can retain more urgent care visitors. If there are any tests that are started, like a point of care urinalysis, once they're resulted, it'll be in the latest for you section. Tests looks fairly similar, except of course it's simplified. There's videos for certain tests, point of care x-rays, complete blood count, and the like. It'll move forward automatically. So once you have been seen by a nurse, maybe you're in the waiting area because it's a really busy time, it'll show you your place in line. It'll also show you education along the way. We put together playlists for basically the most common dozen reasons for coming to urgent care: the cold and flu. Here's why you aren't necessarily going to immediately get antibiotics because they don't work for viral conditions. The UTIs and dysureas, the rashes, the minor musculoskeletal issues or injuries, vaccinations, workers' comp. So there's basically a playlist for each. So we use the reason for visit and we use AI to categorize it and put up a playlist. So there's something for people to do in any wait time that they have. A unique feature of urgent care product is also the excuses part. So you can request a school excuse or a work excuse, and you can set this up to be either automatically approved or you can say approve or deny in the back end. We like to set it up for just automatic. Anybody who has over a certain level, AI can help determine that, automatically approve them for a day or 2 days or 3 days, however you want to configure it, for a work, school, or caregiver excuse. That's fun for the patients, and it also takes that task off of your staff. As you move through here, once you are discharged from urgent care, hopefully that's only 45 minutes or an hour, you're going to see our Access Advisor product is built straight into urgent care. So that means that you're going to see what your care instructions are, and you can read those. That's going to tick that off. Here's the follow-up that you need. And this is going to show you options within your health system. So unlike going to Find a Doc, which is overwhelming because there's 250 cardiologists in the Chicago area, it's just going to show you the 3 or 4 that are matched to, in this case, accept United Insurance, good reviews, low cost, schedule a primary care visit, pick up your medication so it knows which pharmacy those have been sent to. You can mark that as done. And then if there are any diagnoses in here, it's going to have education available for the patient. You can configure it, usually it's 7 to 14 days post-visit. The other thing that we're going to do is send them a text message when test results are ready. Sometimes test results in an urgent care scenario, because you don't have a full lab like a hospital, aren't ready for a day or two. They're sent elsewhere. Communicating those can be a pain. And so we'll just send a text message that says your microbiology or your bacterial culture is ready 24 hours later. That way you don't have to do a thing. All of this is meant to give you higher patient loyalty, so more people come back to your urgent care, and then to reduce leakage, basically keep people within the system and make sure that urgent cares function as just a really good feeder into the rest of your health system. Um, that's Vital Urgent Care as it stands today, and we're always making improvements. Let the team know if you'd like to get this up and running. It's pretty easy. Thanks.